Good afternoon, everybody. Thanks for tuning in today to our virtual care tips for continuity of care virtual care webinar, our weekly series. Just a quick 15 minutes to go over some tips and tricks for providing virtual care in your clinic. This week, we're going to talk about some of the features that really help move things along from a virtual care perspective when you're using secure messaging services. So we'll go in quickly. With me today is Mark Eyre, our director of customer operations. So Mark works very closely with clinics and has for a number of years looking at how to implement virtual care. So the features that we'll cover today were added based on feedback and requests from clinics. So we do work very closely in making sure that the service of SecureMail does work for clinical needs and adapt sort of as things change in the environment. Mark, you want to say hello?
Yes, thanks, Jeff. Hi, everybody. Thanks again for joining us. I'll let Jeff sort of lead off here for the next few minutes, and then I'll come in with a demo here very shortly.
Yeah, so we're just going to talk quickly about, we want to talk about efficiency, and that's what these tools are really about. So we're going to look at read receipts, and we're going to look at message recall. So read receipts really, it takes you above and beyond a fax machine. A message that comes in and says, hey, the fax machine on the other end got this data okay, isn't reliable to say that that information has been received by your intended recipient. We've heard many cases of fax servers receiving information, sending an okay message back, but failing to deliver that data onto the appropriate folder. And then the server has to be reset and all that data is lost. There's no way to recover it or know who sent a message in. Meanwhile, the sender on the other end believes that their message was received and is being dealt with. So this read receipts in SecureMail allows you to know when a message is read. So Mark will show you how to do that. It's really easy. You only have to follow up if you have to, so you can see, hey, the message hasn't been read in a day, but I really need them to see that. You can maybe call them or send a subsequent message. There are clinics that use read receipts when they're messaging patients for appointment reminders to if they do bill, if that's part of their policy for missed appointments, to help be compensated for that missed time opportunity. You can know that a patient did read the message that you sent as the reminder. It also allows you to close the loop on any number of interactions, if it's referrals or anything like that. Just quickly to say, hey, I sent the information back and I know they received it, so I'm going to say that this circle is closed here. There are opportunities to prevent privacy breaches. So anytime you're implementing any virtual care system or tools, you want to make sure that you're still maintaining patient privacy in line with the regulations in your jurisdiction. That's really important because even as we try to scramble to make things work during the pandemic, we do not want to jeopardize the privacy of patient information, because that can have serious repercussions for patients as well as the clinic and any providers. So just a quick look at the virtual care workflow and how we tie into this. Using SecureMail, you have your virtual front desk, which allows any assigned staff to address messages as they come in and make the decision on what needs to happen there. Can patient concerns be addressed by the front desk through the virtual front desk in SecureMail, or do they need some sort of physician involvement? So you can see here the patient messages come in through the staff at the front desk, and the physicians can be brought in as messages are triaged to the appropriate physician. And those conversations can either go back through the staff at the front desk, or they can be taken sort of one-to-one between the physician and the patient. We see statistically and in studies, if you read into a lot of this stuff, about 2/3 of messages that come in from patients do tend to require some sort of physician interaction. So you can just kind of get a sense. And the average number of messages coming in a normal time, not necessarily pandemic, is about 5 messages as an average, with a peak of like 15 to 20 messages coming in from patients a day. So it's not a huge volume. Just looking quickly, I won't go through this entire process, but you can get a sense of what the decision tree looks like for dealing with virtual care requests or any care requests in a virtual way. So front desk staff using the virtual front desk of the SecureMail shared inbox can assess a request sent in by a patient and decide what needs to happen with that. Is that something they can handle directly? Do they need to collect more information from the patient? Or do we need to send this directly to a physician And can the physician either conduct a virtual care visit or a response, provide advice through a secure channel like SecureMail, or do they need to conduct a consultation either through video or phone or an in-person appointment? So that's all stuff that can be managed using SecureMail. We can make those decisions, set up the appointment, send any prep documents. So we do know that clinics that kind of send prep documents through SecureMail in advance of appointments tend to be able to double the number of patients they can see, and most, or even just improve their capacity by shortening the length of the appointments because they're collecting a lot of information up front. And then, of course, you can involve other providers through an e-consult. So if you need a specialist opinion on a particular patient concern, you can forward that to them. Any specialist that would be appropriate, and those processes, so consulting with a patient through secure email and providing and asking for an e-consult through secure email, are billable in Alberta. So we've got the codes there. Obviously, consult the AMA for the full details on those codes. But that's just kind of a picture of how things look. And at each step of the way here, you can perform a check to see if the messages were read, and at any time, if appropriate, let's say by accident a message was directed to the wrong person, we can pull that back. So I'm going to turn things over to Mark just to kind of take us through a demonstration. Let's see here, Mark, are you able to grab? You got it? Good.
Yep, I've got screen broadcast already, I think.
Yep. We got you coming up here.
Oop. I seem to be selecting the wrong button. One more try here. There we go. You should be seeing my screen now. Is that coming through, Jeff?
Yep, gotcha.
All right, wonderful. So so I'm just going to show you a quick little demonstration as to how the read receipts work. Jeff talked about how important it is that in most cases, when you're sending patient health information, it's often very time sensitive. And with the last thing we want is for important clinical information to get lost or forgotten about. So here's an example where I'm already composing a message. I'm logged in as an office administrator at a particular medical practice, and I've already addressed a message to my patient, Adam. My subject line is a COVID-19 self-assessment form. And to save time, I'll just quickly bang in a message there to the patient. Now, in this case, I'm sending him a form that I'd like to complete. Maybe it's critical that we get this form back quickly so that the appropriate testing can be done for this patient, or some other reason that's making it of an urgent nature. So I'll go over to my attachment section and I'll grab the file that I want to attach. In this case, just this PDF document that I have here in my folder. And when I'm all happy with the message that I've got, I'll just click send. So in most cases, if I'd sent a fax or an email or an old-fashioned lick-a-stamp letter, I would have no way of knowing if the recipient ever saw this message and viewed the information. Within SecureMail, however, as Jeff was saying, I can now go into my sent folder, and you can see this message here that I just sent a few seconds ago. It's in bold at the top of my screen from Clara Barton. And if I select this message, you'll notice that over here next to the patient's name, there's a little tiny orange box. And that little orange box indicates that this message has not been read for obvious reasons. It was only sent about 10 seconds ago. But this lets me know that the message hasn't been viewed yet. If I select a different message, if I go down here to a different test with someone else, here's another test with Adam Abel that I did yesterday. And in this case, if I point my little mouse cursor up to this message, we can see the message has been read. And it even goes so far as to tell me exactly what time and date Adam opened and viewed this message the very first time. So this way, if I am sending critical information, whether it's to a patient or to a consulting physician from whom I need to get an opinion very quickly, it's much more convenient for me to now know for certain that either the patient has read the message and is sensibly about to respond to it, or the clinician that I'm trying to communicate with has seen my query and hopefully will be getting back to me with an answer very, very quickly. Now, while we're on the topic of read receipts, there's another really important tool that goes along with this feature, which is the ability to recall a message for any reason. So for example, if I go back up here to this message that I sent to Adam, a few moments ago, and if I go over to the far right-hand side next to the timestamp, there's a little option here to recall this message. Now, Mistakes happen, and sometimes you'll send a message to Adam instead of Alan or Mary instead of Mark. And have you ever sent an email and had that sinking feeling in your stomach just after you clicked send when you think, oops, I sent this to the wrong person? With traditional email or a fax machine or lick stamp letters that you put in the post office box, you can't get those back. Once you've clicked send and you have that feeling in your tummy, it's too late to do anything about it. However, within secure mail, you can recall a message that's been sent. So in this example, I can simply click the recall button, confirm that I don't want to send it to Adam anymore. And that guarantees me that this person will not have access to the body of that message, the attachment, or the subject line. All of that information will not be in their inbox. There will just be a placeholder there that says, someone sent you a message and then recalled it. So that way you can, undo a mistake that you may have made. So if there's a potential for a privacy breach or something else, you can recall that message and ensure that that wrong person does not have access to it. Now, I should also point out that in the example that I just showed you, Adam had not yet read the message. So when I pull it back, I know for certain that he never saw the information I didn't intend him to see. You can still recall a message even if it has been read. Now, of course, that won't undo their memory. They'll still know that they saw it at some point, but at least it can reduce confusion sometime down the road. So with that, I'm going to turn the conversation back over to Jeff to sort of wrap us up. I know that we're getting close to the our 15-minute time limit, and I don't want to take too much of his time. So I will turn it back over to you, Jeff.
Great, thanks, Mark. I'm gonna grab things here. Before we finish, we're gonna do a quick poll here just to kind of get a sense of what kind of things we'd like to cover in the next few sessions going on. We do have some plans for the next couple of weeks, but if you have ideas about what other information about providing virtual care you would like to learn, we would certainly be interested in what you'd like to hear. So I will put up a quick poll here. We'll give you a couple seconds, everybody, to respond. And we'll carry on from there. But as we wait, there are a couple things what Mark's covered, which is really interesting things. I think from a virtual desk perspective, virtual front desk perspective, you think about the use of telephone to manage appointments. Leaving a voicemail for somebody. I for one don't check my voicemails very regularly. It might be weeks before that goes through, and you don't know what's happened with that voicemail if you've left it. Asking someone to call you back with using secure mail instead helps you be much more efficient and effective because you are aware of what's happened to your communications at the other end. Let's see here. We do have some answers. We've got some people coming through. So I'm just going to, we're almost done. And I'm just going to close the poll in about 3 seconds. And then we'll continue on and wrap things up at the end. Okay, so here we go. Close the poll. We'll take that. Thank you very much for your participation in there. And just reminding you, so keep your practice protected. Make sure you're using safe and compliant or regulated services and tools for your virtual care program. And if you need to kind of get a sense of where you're at from a privacy perspective, there is the privacy risk assessment on brightsquid.com. You can access it through our homepage and just fill out a couple quick questions. One of our support reps for onboarding and Brightsquid will follow up with you to review that. If we haven't done your privacy already, we can certainly help you get privacy compliant. If you have any questions about any of this at any time, please reach out to us through support, and we can help you get established with your virtual care. So thanks a lot, Mark, for that. I think it was helpful, and we will be back here next week, next Friday. This week is a bit anomalous, but we'll see you back then. Thanks, Mark.
Thanks, everybody. Bye-bye.